As a nurse, it is extremely important that we are advocating for our patients. In my specific example of the increased rate of unnecessary C-sections, we must first acknowledge the barriers that the nurses currently have and work around that. So some barriers that currently exist may be a lack of resources that the hospital have. So it may be a lack of peanut balls or squatting assistive devices, both of which would allow mom to labor in a multitude of positions and help for a faster progression of labor. In addition to that obstacle, there may be a hierarchy of power that exists on that unit in which the providers may not care for the opinion of the nurse, which may make it harder for the nurse to speak up. So some ways that the nurses can ensure positive patient outcomes is by speaking with the patient directly. By educating mom, we are able to ensure she is making an informed decision, and with that increase in knowledge, she may be more likely to stand up for herself. Studies have found that this information is best provided or best absorbed by the patient when provided in layman's terms, so when the information is easy to understand, as well as when it is provided alongside emotional support, so when the mother is feeling heard and cared for. In addition to informing the mother, we can advocate for better resources on our unit. Reason being that, as I said earlier, for example, the peanut ball, studies have found that when that is utilized in labor, the rates of C-sections do decline because it is allowing for a faster progression of labor. Lastly, it is so important that we advocate for our patients. We can advocate in a multitude of ways to ensure that an unnecessary section is not being done. One thing that we can advocate for is the increased use of vacuum-assisted deliveries. This is one option that we can utilize before jumping to a major surgery. Another thing that we can recommend is getting a second opinion. This ensures that if a section is being done, it is being done because it is medically necessary and not because it is convenient to the provider who first suggested it. By advocating for our patients, we are ensuring that the patient is getting a surgery because they need it, and we are not doing what is best for anybody else apart from the patient. So we are able to ensure the most positive patient outcomes and ensure that they are getting a great quality of care.